Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, everyone. Thanks for tuning into this episode of Impact. I'm your host, Shane Allen. Happy Pride Month. It's June. We made it halfway through the year. It's Pride Month. And you would think it's weird that the DIFFA Impact podcast is going to be talking about Pride Month because we harp all the time. HIV and AIDS is not a gay man's disease. It affects all communities, but it does disproportionately impact our community. And I thought I'd bring into this conversation this week Dr. John Carlo. Dr. John Carlo runs Prism Health North Texas. Always glad to have you on, Dr. Carlo.
Thanks for having me on, and appreciate the opportunity to be here, and especially want to thank DIFFA for all the great work they're doing in supporting this community and addressing the crisis with HIV and AIDS in our community.
Yeah, we're so proud to support Prism Health as well. So 2 million people, roughly, in the United States living with HIV and AIDS. Gay and bisexual men make up 2% of the total United States population in 2013. But in 2013, they made up 55% of those who were living with HIV and AIDS in the United States. The trans community also disproportionately impacted by HIV and AIDS. And lesbians, you're not in the clear either because of the messaging regarding HIV and AIDS being geared toward men and gay men and women of color. Lesbians often don't get tested because they're not even thinking about it. So talk a little bit about that, about what organizations like Prism Health North Texas are doing to try to get these numbers down during Pride Month.
Well, you bring up some great points. I think it's first, while we're not really talking about HIV and AIDS every day like I think we should be, it's certainly not as much in front of us as it was in the 1980s. Your point about the number of people living with HIV and AIDS today in this country, we have more people living with HIV and AIDS today now than we ever have, thanks to the great treatment. But this does show that we have a lot of medical needs to address. We have a lot of people that need continued medical care, and it's continuing to be a problem. Your point also on the percentages, and everyone can be at risk for HIV and AIDS. There is not one particular person or type of person that would put them at a different risk necessarily. But it is at higher risk for gay men. And, the numbers you gave is correct. But one of the concerns I have is the number of new infections in this country is showing to be up as high as 60 to 70% gay men and gay men, particularly of color. So we are seeing some further trends that we need to really be concerned about. But again, to the point that you're making, yes, absolutely. This is a virus that can infect everybody and does infect everybody.
You talk about the percentages of new infections and things like that. How does Texas and North Texas specifically, how do we over or under index in that? Where are we in new infection rates?
Well, unfortunately, we over-index. The consequences of both living in the South and being a state that has a lot of concentrated urban areas really puts us at higher risk and higher numbers, and we're seeing that. So, if you look at our counties, our big counties like Harris County, Dallas County, Tarrant County, we're in the top 10 of any counties in the United States in terms of new infections and infection rates. So, we are disproportionately impacted. It's a result of our healthcare access in many ways, and it goes back to, how we have challenges in our community, both around education, access to healthcare, and, general awareness of the conditions that are in our community.
How much does stigma play a role in our infection rates?
Unfortunately, too much. It's a huge issue. It's still today a huge issue. We find, our patients come in to see us. They've been living with HIV and AIDS for many, many years. And this stigma creates denial. And many come in to see us only when they feel so bad. And unfortunately, we have many circumstances when we see them for the first time, we have to call the ambulance and send them to the hospital because they are so sick and they've waited for so long to go and get help. And, I think stigma plays a huge role in that. I think that there is so much that could be done to better address that so that people feel comfortable getting tested, people are comfortable being in treatment, and are just really more aware that this is something that can be addressed, and it can be addressed very easily.
I think that might become a surprise to a lot of people. We think of HIV and AIDS being something that someone will die with, not from, and that's true in most, if not all, cases. But the fact that in 2021 there are still people that are waiting so long for treatment that they require hospitalization. What does the journey for someone like that look like?
It's a really tough journey because, a lot of times you can watch over a decade of suffering from HIV. It's a degrading illness where you can slowly watch your immune system tick away. You start getting more and more infections. You start losing weight. And, generally, if somebody has waited that long, it's pretty profound, in terms of the condition and the overall things that are going on. And, we see this, unfortunately, too many times. I will say the good news about these stories that continue to happen is, even if we do see somebody who are literally on death's door, we can put them on treatment. And the treatment is so good today, we can turn that corner even in those cases. And I think that that's another just really remarkable thing about HIV treatment today is we can take somebody that has that situation and they'll come back and see us, over the next few weeks, and about within 6 months, sometimes we don't even recognize them because they've gained back the weight, they look better, they feel better, they're smiling more, it's a different person. And so this is just that remarkable thing that happens every day in our clinics and around the community that's good stories. But, the bad news is these cases continue to happen. And, that's just really what gives us a lot of, frustration. And it is hard to watch these cases unfold.
And what I love about Prism Health and other organizations like yours in North Texas is as much work you do to penetrate the community, to make sure people are getting tested, to make sure people are practicing safer sex, to make sure that if you were assigned male at birth and you have sex with men, that you're on PrEP. And what I love about Prism as well is you meet people where they are. And at the same time, you're everything to everybody. And I'll explain. I was at Gay Bingo at the Resource Center, and a representative from Prism, and I unfortunately forgot his name, came up to talk at Gay Bingo and said, "Who wants to talk about dirty, nasty sex?" And that got my attention. But he used this as the opportunity to get everyone's attention because, you stand in a room full of people and say that, of course they're going to look up from what they're doing. And then that was the perfect opportunity to talk about safer sex and things like that. So I love that. You all have a podcast as well. Still waiting on my invite. I'm kidding. And I think it's great that Prism is working to reduce the stigma surrounding HIV and AIDS. It's so important. I remember when a member of my family was diagnosed with HIV, he called me as if he were writing his will, and I was like, calm down, this is going to be okay. I understand what you're feeling. I know that this is a shock to you, but it's going to be okay. And he thankfully had an organization in his town, much like Prism Health, that was able to connect him with the right resources. And
Great.
And he's, living an undetectable life now.
That's great. Well, thank you. No, we have a great team, great staff, and it is amazing. It's a pleasure to work alongside so many great people. I think you point out another thing that's very, very unique to kind of where HIV and AIDS is today. We think of it is a chronic disease like many other chronic illnesses that we all face. but the way we address it is much, much different. You know, we wouldn't have given that speech that you heard to a group about diabetes awareness or hypertension awareness or other health conditions. So it's a remarkable way that we've come around through this process, and a lot of it goes back to how we formed in the 80s, and really that again, and going back to that marginalization and that stigma, and realizing that we had to do things very, very differently and really reach people where they are. And really, we're really, a lot of the newer things around chronic illnesses are learning from a lot of our experiences, because, you know, we had to do these things. We weren't going to reach people, even with good treatment and good testing. We weren't going to reach people unless we made those differences and made those changes and did what we did.
You know, speaking of the 80s, obviously HIV and AIDS affects every community. It doesn't care who you are or who you sleep with. But, you know, it was originally called the gay cancer. It was originally called GRID when it first emerged. And how did HIV and AIDS seemingly start in the gay community?
You know, I think this is an important story. I think it's important to remember that it didn't start in the gay community. In fact, you know, for many, many years, HIV and AIDS was circulating around the planet. We just didn't know about it, and we weren't looking for it. And really, the only reason we found it back in 1981 is that a doctor in Los Angeles that happened to have a practice that saw a lot of gay men happened to notice a very consistent syndrome that was happening in, you know, normally young, healthy gay men. And so the recognition of HIV as a virus, actually, the gay community is, you know, should be, you know, celebrated for that, because, you know, the other part to that story is, you know, LGBTQ, you know, being out more in the open was a newer phenomenon back then. And so the fact that we were using our gay identity more and were more out, I think it enabled us to find HIV sooner, because it had that connection to a very unique population, and we wouldn't have found it otherwise, even though it was circulating around the planet in many, many other areas, just not being detected. So, you know, there is a big story to the history. It aligns well with our own history in the gay community and how we reached and achieved equality. And, you know, of course, we have a ways to go, but, you know, it really is a part of that time back then and how that unfolded to how the HIV and AIDS story became so connected to the gay community. You know, and I do think that did create a misperception, as you point out, because, you know, sex was only one of many different ways you could actually get an HIV infection. One of the more common ones in the 80s was blood transfusions. And, you know, we had many, many people that got HIV and AIDS through blood transfusions. And what's remarkable about that, there was even stigma for those folks to not even be open about that diagnosis because of what it might have meant or represented to the community. You know, I think good examples are like Arthur Ashe or Isaac Asimov or other people that very likely had died, but we didn't even know that that's what it was.
Right. You know, it speaks to the struggle of the LGBTQ plus community throughout the years, especially in the 80s. You know, we didn't start it. We were just easy scapegoats.
Yeah, it was a obviously tough timing for that, because I think, you know, there was just beginning to be an identity and an awareness, and I think it was unfortunate that we had to then go through this and deal with you know, the condition of this pandemic. You know, but I do think that there is in this history a lot that can be learned from that experience. You know, you're keeping in mind that we're dealing with things that people don't like to talk about. We're dealing with sex. We're dealing with injection drugs and sharing needles. We're dealing with marginalized communities. And on top of that, we're dealing with a virus that really is like no other, and that it can exist for many, many decades without detection and has all of these things that we have to deal with. But, you know, that is where we were to where we are. And I think it shows, again, this remarkable achievement of what we've been able to accomplish, because, you know, the treatment now is absolutely remarkable. We can make people undetectable and the lifespan will be normal. We have testing now that you can do at home. You can do testing and get your results back in as little as a minute, and it's incredibly accurate. So, all of these things came from our history, and a lot of that was the result of the activism of the LGBTQ community. I don't believe for a second we would have gotten the medications that we have today if it wasn't for all of those folks like ACT UP and Treatment Access Group and all the people that stood on the streets and walked and really stood up against this problem, this threat.
And, not to toot our own horn, but DIFFA, who was also formed in the 80s. How close are we to a cure?
I've been answering this question very differently lately because we have to start asking ourselves, what is a cure? And so work with me for a minute on this. We now have treatment that, when taken every day, can make somebody undetectable. The virus is completely just silent in the body, and that person is no longer infectious to another person. We've been using the term U equals U, undetectable equals untransmittable. And so I think you could make an argument that that is very close to a cure, because the main things we don't want, obviously, is to have infection transmission or have disease progression. And so we've been able to accomplish that. Well, what do we do from that? There's new things like long-acting injections that are coming around, and we've just had one last year approved, where no longer you have to take a pill once a day. We may be able to do an injection, maybe right now it's going to be once a month, maybe once every 2 months, perhaps maybe once every year. And so to me, we are probably looking at cures. We just need to better define what that exactly means. And, there are some really interesting things around truly a cure, which means you could go off medications and still remain undetectable and not transmissible. And they're not too far down the road. We've seen some exciting things on being able to really eradicate the virus fully and not have it rebound, even without treatment. So I think we're remarkably close, and it really is exciting to be able to talk about that today.
Isn't it great to be in a position where you're kind of working yourself out of a job in a good way?
I think so. I absolutely agree. I hope I can work myself out of a job. I will say, unfortunately, we still have a ways to go, as we kind of started talking about. There's just, even with this treatment that we have, even with all of these things that we do and the awareness that we raise and the great work that DIFFA and the community has been bringing in terms of resources and awareness, we're still not reaching everybody. And, it's sad to see that we still have folks coming in that have been living years with HIV, and we could have done something differently had we reached them earlier. So I think we have a lot to celebrate, but yeah, there's still a lot more we need to do, particularly in Texas, particularly in Dallas, and we've really got to keep going at this point.
I'm telling you, stigma may have 6 letters in it, but it might as well be a 4-letter word. It's
Yep.
the amount of weight that small word has is tremendous.
And it's incredibly complicated. It's not a monolithic situation. I mean, we're dealing with, very, very challenging components to this. There's stigma around sexuality. There's stigma around disease. There's stigma around socioeconomics, and, all of these things come into the picture around addressing the HIV and AIDS problems in this community. You really cannot address what we call all of the social determinants of health in a community, and that without, you're not going to get success unless you're addressing all of those things together. And that's why one of the big things that HIV and AIDS service organizations do in this community, and again through the generous support of DIFFA, is that we don't just provide the medical care for patients. We know we have to provide transportation to get to those medical appointments, because if they can't afford getting to see us, then they're not going to come in. We know people have housing instability, and they're never going to get to where they need to be with medical care unless we address the housing instability. Same thing with food and nutrition. It just all comes together. We realize, again, with all of this great treatment that we have, if we don't apply sort of this whole approach and don't really build the resources to help people get through their process and their journey, we're not going to be successful. And again, that's why this is a very, very different type of a chronic condition that we take care of. But I will say again that this community, through the partnerships with the different groups that are supported by DIFFA, we've really made some amazing successes and outcomes and really addressing those really, really difficult cases and really making a huge difference in people's lives.
Yeah, look, I have to apologize to our listeners, too. It's Pride Month. It's supposed to be fun, and we're supposed to be having a great time. And this is a DIFFA podcast. We're the fun organization in town. But there's a light at the end of the tunnel. And if we're ever going to reach that light, we have to have conversations like this. So, Dr. Carlo, thank you so much for joining us today. We really appreciate it. Thank you for all the hard work that you and your colleagues at Prism Health North Texas do.
Hey, thanks for having me on. It's been a pleasure, and thank you for all the work you're doing. And yes, we'll try to get you on a podcast soon.
I was kidding, but I'll accept that invitation. You can learn more about Prism Health North Texas and all of the organizations that DIFFA Dallas helps out in North Texas by going to our website, diffadallas.org. Until next time, I'm Shane Allen. Thanks, everyone.